So they can see this and we're live.
All right.
So, Dr. Hackard, this is the pre-game, the pre-show, the warm-up.
Okay.
It gives folks about 5 minutes to start joining in, chiming in, checking in.
Joining in, chiming in,
I'm sorry, I forgot my
sharing.
notes.
Sharing.
Okay. Yep. And Yvonne, if you look on the right side, you can see the comments button. You see that?
I see it. Yep, I got it.
And that's where you can see comments as they come in. So
yep, it's open right now for me.
Yeah.
Okay, I feel like I'm sitting weird. Do I look like I'm sitting weird?
I can't see you anymore.
Okay, good.
It's just a cool leather jacket.
Oh, I can. You can't see her. I can. You look good, girl. You look good.
Okay, all right.
You look good. I'm gonna go grab a necklace.
You go grab a necklace, and people go grab a friend. Lots of people are asking questions about COVID vaccinations, the rollout in the Genesee County community. If you don't have a question and you have someone in your network that does, please share this. That way they can jump on into the comments and ask their questions directly. We have some amazing panelists today that are ready to answer your questions about vaccine rollout. And so again, share. We're looking forward to an amazing hour-long conversation.
Yes, with our health officer.
Hold on, health officer, medical director, MD, JD, MPH. I'm ready for this conversation.
Thank you, Zeke.
I know. I feel like an inner fever all of a sudden. I was feeling real good until I typed up all of her credentials, and I was like, I didn't do it.
Oh, please.
I could have done more.
It was not intentional.
Well, we are grateful and happy to have you.
I kept finding one more thing I thought could help.
Uh-oh. I know. I meant to tell you, Isaiah, don't play any music either. I got to get Gabe's music on, because if you play music, we run the risk of copyright infringement.
Yeah.
Yeah, that's how that goes.
I think you get like 30 seconds or something.
Oh, do you?
Yeah.
I'm gonna get some Gabe Holden original music on here.
Well, sadly, I had 40 things open, and then when I pulled away for a moment, oh, there we go. Nope, that's Zoom. I'm just trying to find it again. What does this icon look like?
You look okay. You might want to tilt your camera down just a pinch. If you can. That's better. That's perfect.
Thank you.
I can see you all, but you can't see me.
So are we live right now?
We are. They can hear us, but they can't see us just yet.
Okay, let me
just give folks a yeah. Okay, you got a minute.
No. Oh, there we are. Okay, I'm not kidding. I really had 40 different things open. I'll be right back. Oh, I can't find my briefcase.
Yeah, and the countdown begins.
Sweet humanity. We are live, guys. We are live. You got 10 more seconds, guys. 10 more seconds. And good brother Isaiah, it's now to you.
All right, man. I'm excited about the opportunity to have some conversation with such amazing people today. We've been talking for the last few weeks about the vaccine rollout, myth busting, doing everything we can to make sure people have the information they need to make the best decision for them and their families. Been getting lots of questions in my inbox. I'm sure Dr. Debra and Dr. Hackard and Miss Yvonne Lewis has been getting lots of requests for information about the vaccine rollout. Where can I sign up? How long should I be waiting? How long between boosters? Just all of those general questions that you have and you don't have a person to ask. What we've been able to do is use Facebook and Facebook Live, almost like an Ask a Nurse. You call up, you jump into the comments, you ask whatever questions you have for you and your family, and we'll see to it that someone on the line gives you an answer or lets you know how we'll get information for you. And so today we have some amazing folks. So again, I'll say share. If you don't have a question, please share it with your networks. Someone in your family has a question about this vaccine. No question is stupid. No question is bad. We want to make sure everyone has all of the information they need to make the best decisions for them and their families. Today, I have with me, and I'm going to start in my very top box. I have Miss Yvonne Lewis, community ambassador. I've known Miss Yvonne Lewis for a long time. She's been an advocate for people getting what they need to support them and their family for years in this community. I'm so happy that Miss Yvonne Lewis is here with us today. Next box I have under is Dr. Pam Hackert, our new chief medical officer and hold on, I just said that wrong.
No, medical health officer.
Medical and health officer. I said it wrong because I think you might be the first person to hold both roles and the first woman to hold both roles. And so we're excited to not only have you in our community, but we're excited to have you here on the call to answer questions about what's happening at the Genesee County Health Department and what your role is in supporting the people of Genesee County and getting what they need with regard to vaccines or other public health related issues. And last, but certainly not least, I have Dr. Deborah Furr-Holden that we're excited to have with us today. Family love. This is our trained epidemiologist. We talk all too often. This is our Dr. Fauci. She's the person with 20 years of epidemiology. Hold on. How do we say this word earlier? Because I messed it up again.
Epidemiologist.
No, I know how to say epidemiologist. It was epidemiological. Right?
Yeah.
Was that it?
Epidemiological.
Epidemiological experience. So 20 years epidemiological experience that she brings to the table, lived experience in engaging in communities, both here in Flint and in Baltimore. So she understands the urban center and she understands the response, not only to what we would describe as a public health crisis with regard to health or COVID, but she's been doing it around violence and drugs and all kinds of stuff. And so we're always excited to have Dr. Debra with us. That said, we got a number of people that are going to be jumping in. Again, ask your questions in the comments, but I'm going to start by just allowing them to introduce themselves, give you a minute or two apiece, just to say who you are and what you do and why this time is important for you. We're going to start with Miss Yvonne Lewis.
Thank you, Isaiah. Yeah, you make me feel older, mature. I've been here, yeah. So I've known you for a long time because I've been in Flint for 45 years now, and most of what I've tried to do here is to provide information and education so our community members can make an informed decision. And I say that because I am a community member. Often we talk about our academic credentials, and yeah, I went to school for a few days, but most foremost, I live in this community. And as I've had different experiences, I've always felt like there was a bit of information that I didn't have that then prohibited me or got in the way of me making an informed decision. So, the historical struggle of just not being in the room, not getting the information necessary at a time where you can make a good decision. So background, being here, worked in community organizations for a lot of years. In the last few years, I founded the National Center for African American Health Consciousness, because one of the things I realized as we talked about health and health disparities, when I started looking at health disparities in 1987, I got to 2010, and I looked and the health disparities were still the same and actually got worse. And I thought, with the African Americans facing this, what do we do to make a difference? We have to raise our level of consciousness, be really clear about what's going on. What do these, Dr. Deb, the epi lady, what does all of that mean? I talk to the doctor sometimes. I don't understand that language. So what does it mean? as it relates to me as an individual, my family, and then how do I make the best decision for me based upon my circumstances. So that's what I'm advocating for still after all these years. And I'm glad to be a part of this conversation with you tonight, because we're going to keep asking those tough questions and saying, what do we need to do to make sure our community has the information they need to make the best decision in an informed way for themselves and their families.
Thank you so much. Dr. Hackert.
Hi, so I'm Pamela Hackert. Really glad to be here. Thank you for asking me. And I have a similar experience. So medicine was my second career. I didn't start medical school until I was 29. So I had, 29 years of being, an educated, smart person who had no clue what those medical terms were. And I have the good fortune to have remembered what that feels like and what kind of things could just throw you. The one specific example, so you're getting a little bit more of me with this. The one specific example was my husband had this horrible back pain, passed out from it, went into the hospital in an ambulance. They told us he had myositis. I can't remember anymore now what they said, but we thought, oh, it's this horrible disease. And then I got to medical school, and a year later I called him up and I said, it was a muscle spasm. That's what that meant. And we thought he had a disease. So I remember how to explain things to people. So so if there's anything I say during this, please just say, wait a sec, what's that mean? I just saw one of my favorite people, of course, in public health is Dr. Fauci. He was on Anderson Cooper last night trying to talk about the new variants of this virus. And he kept using the word in vitro. And Anderson kept trying to get him to say it a different way. Like, what does that really mean? And he just totally didn't get it. He kept saying, using in vitro, like everyone knew what that was. It's like, I know I didn't know what that was before. So happy to help in any way I can with any of your questions, whether they pertain to what our plans are for rollout, whether it pertains to difficulties. I know many, many people have experienced, and we have plans in place to address that. Or even just what in vitro means.
Thank you. Dr. Deb.
Hey, so I'm Deborah Furr-Holden, epidemiologist. I'll take the name of the local Dr. Fauci, or we could call him the national Deborah Furr-Holden, whichever one works for you, Brother Isaiah. I'm an epidemiologist by training, Associate Dean of Public Health Integration and Director of the Division of Public Health at Michigan State University. I started off on this journey with you, Isaiah, because I have a commitment that people have everything they need to make a choice. And I believe knowledge is power. And so I just want people to operate from fact, not fiction. And so I'm like, let's just make sure they got the facts. And the thing that I'm really understanding in this journey is that it's a myth that people are operating only from misinformation. Some people have information and have just chosen no or no for now. And as things change, I want to make sure that they have access to the information, because many of us are inching along the continuum in the decision-making process around whether or not to get the COVID vaccine. And then we've got all kinds of barriers for people when they do choose. So I really am committed that people do the work, grapple now, so when their number comes up, they don't lose their place in line.
All right.
Yeah.
So we're going to have some fun. We got 45 minutes, straight questions. I'm looking forward to seeing them in the chat. And we have one from my cousin, Kiki. Kiona, hey, how are you? Love you, cousin, by the way. I guess as me being a new nurse, and congratulations on that, by the way, being a new nurse and affected by COVID myself, as far as losing a father to it and by my oldest daughter being exposed to it and me being hospitalized with it, I guess my question is, why would I feel that the COVID vaccine can help me when I already have been heavily affected as being a healthcare worker and I've been exposed to the virus up close and personal? So how should I feel that this vaccine could help me? I'm going to throw this to either Dr. Debra or Dr. Hackard. Please jump in.
I can take that one. So I'm sorry for all that pain you've been clearly having to go through the last 9 months. But there are a couple good reasons. One is that the vaccines, with the variants we're seeing, but there are some new ones, the vaccine is protecting more than actually even having had COVID. We know that's probably good for 3 to 6 months to protect you, but there are definite some reinfections. And being a healthcare worker, you're going to be continuing to be exposed. And this is one of the things that you can do. With the question of the variants coming and whether or not the virus is going to help you in particular because you've already been exposed, the answer is most likely it still will, because those are showing to be not 95% effective, but they're probably closer to 80% effective. And what the plan would be is, if those variants become something that's widespread in our community, they are going to be able to give a booster shot like in a year or so, just as like the regular flu shot would be, that could address those new kinds of variations of this virus. And if you have a follow-up question, if I didn't answer your question, if there's a specific spot, just feel free to put in the comments.
Please throw any follow-up questions in the comments. We are hit right now with a straightforward question. We need facts, no chaser on this one. Thank you, Mrs. Bailey, Sarah Bailey. Why is it taking so long for this 70-plus-year-old person to get the vaccination?
So that's probably for me too. So we have been working with our senior centers who've been invaluable in being able to take information for people. We also have the Survey Monkey for people who want to use the internet directly. The Calling the Senior Center will get you on the same list as that. And our demand is really high. The people who are filling out the Survey Monkey should only be ages 65 and up right now. And we have over 30,000 people on that list. We have now, we're getting about 2,000 to 3,000 vaccines a week. And then in less than 10 days, we've had 30,000 people sign up to get a vaccine.
So
can I give the real number rundown as an epi person?
I was gonna ask you someone to do that, please.
Yeah, I'm gonna say exactly what Pamela, Dr. Hackert said.
Pamela's fine. You can call me Pamela.
Yeah,
it's after 6.
Watch this. Yeah, we have 2,000 vaccines coming in per week. We have 2,000 people per day signing up. So the math doesn't add up. This is why we started these conversations well over a month ago, because we wanted people to grapple and do the work. We had a lot of frontline healthcare workers who chose no, and that's okay. And then they had a change of heart and chose yes. The phases, the 1A, where we started with the healthcare workers and the people in group homes and long-term care facilities, those things are now running concurrent with that phase 1B. So people who were in line and said no, they didn't lose their right to be in line. They did lose their place in line. So you got to think, if we have 2,000 vaccines coming in per week, and we got 2,000 people over the last 10 days signing up per day, the supply is now not meeting the demand. That's why it's important for us to do this work and people to make their choice and be ready if your number gets called, so that you can get in line.
Dr. Debra, let's take
bottleneck we can't control.
Let's spend a moment here. Let's just spend a moment here, right? Because for those of us, I don't really understand what that means. I got a place in line. If I miss my place in line, who does it go to? Is it a person in that 2,000? Is it the first person you can get on the line? Is it a person that's at the hospital that happens to be in the waiting room? Who gets that spot?
So I can give you that answer. When we go through and call, we would go to the next person on the long list. We have been working, and one of the great things about this new tool that both the senior centers are asking, as well as, oh, my dog's walking in, I'm so sorry.
My kids are probably going to walk in, Pam, don't worry.
So we go to the next person in line, because we have a very short turnaround. We find out our vaccine availability on Saturday, and on Monday, then we start to call and fill up those spots. And then the vaccine clinics start on Wednesday. So we want to make sure we don't waste a single dose. Occasionally people will, want it, and they get a call and it's like, well, I was working, I couldn't answer it, or I was in the shower, I missed it. So until today, actually, I'm kind of running around the health department, all different spots and saying, okay, well, let's fix this part. And so what we fixed today, at least a temporary fix, is that for the people who were called and missed their call but want to get their spot, we are now putting it where you can, if you call in and say, I had a call on this date, and they'll look at the list and say, yes, you did you want a vaccine appointment? Then you get put to the very, very top of the next opening that we have. And before that, I'm kind of sad to say and embarrassed to say, but when you don't know that's a problem, you can't fix it. And I didn't realize that it was almost getting lost because of this giant influx of numbers. So we really are getting like 3,000 a day people signing up for 2,000 a week. So anyways, at least we now have a way for the people. We have 21 people who've called today. So if you had missed your call back, say 3 days ago, a week ago, and when you called, you were told to call this other number. This is a scenario that I'm ashamed to say has been happening. So you would call the info line and say, I missed my call. I want to still get on the line on the appointment time. They'd say, okay, call this number, and leave your name on a message and they'll call you back. That number had a voicemail capacity of 300. And once it was at 300, it didn't take any more voice messages. And so one person was trying to answer 300 of those a day, which obviously you can't. And so that was an incredible exercise in frustration if you were one of the people who had that happen. Call back again. We have a new way of doing it as of tomorrow, and we will put you back in the reappointment list.
That's very helpful. So I got like 3 questions here that I want to get rapid fire to. I'm hoping that I can get back to a follow-up question about process, how many vaccines we got, where did they go to? But I do have some questions in the chat. The first one, she tried to ask this twice. This is my sister, Trishelle. I guess you don't have to fix your grammatical errors. I can read it. I'm good. After testing positive, how long would I need to wait to get the vaccine?
Okay, so you actually only need to wait 10 days after testing positive. You can wait. They kind of recommend 3 months. Question is, would you want to wait 6 months? That's probably about how long immunity lasts if you've had the infection. But you really only have to wait 10 days. If you are called to get a vaccine, and I'm going to tell you this, I said this on a different call the other day, and I think the people I worked with are a little shocked, but I said, talking as, Pamela to someone else, talking to Pamela to Trishelle, I would want to get the vaccine. I want everything that's going to boost my immunity to fight off future exposures. And so if it's been a month, yeah, go get it.
Okay, second question from Paulette and Sister Trishelle, I'm glad that you're on the mend. Which vaccine would you recommend and why? And just offer some context for the different vaccines that exist right now, and maybe some that we might be hearing about in the news that aren't fully out there yet, because people are hearing about it and it's distorting what they see or their view of vaccines. And so if you can give some context to what's available, then what vaccine you would recommend, and if it even matters.
If you are offered a vaccine right now, you have kind of hit the lottery, and I recommend you say yes and take whichever vaccine it is. That's what I would do. I just wanted to get the vaccine as quickly as I could. And so if I had waited a little bit longer, I could have gotten the different one. I was in Jackson with Henry Ford there and was offered the vaccine, one vaccine through the health department, one vaccine, the different one through the hospital. I didn't really care which one I got. I wanted just to get which one was being offered to me first. They are both the same type of vaccine. It is called a messenger RNA, and that's I had to refresh myself on what that meant, because it's not really new. They've been using that for about 10 years, this messenger. It just basically is a way of carrying the information to tell your body to make antibodies against that virus. It's a way to get it into your body that's a little bit different than taking the little dead particles of viruses like most vaccines are done. So this was a new way of getting the vaccine in, but they've been using it to deliver medicine for 10 years now. And those two are pretty comparable in terms of how well they work, how long they last. And it's one of them, the one that's the deep freeze, that is the Pfizer vaccine, that you get the second booster shot in 21 days. And the Moderna is 28 days. But in reality,
Moderna is 21. Pfizer is 28.
No. Pfizer's the deep freeze one, and that one is 21 days. Moderna is 28 days.
All right.
Look it up. So I've been breathing this stuff.
So yeah, I got a second question.
My bad. You're right. Pfizer is 21 days. Pfizer's 21 days.
All right.
So you be the numbers.
But after I'll say the follow up just behind that one. I've got a question from Miss Bailey, from Elder Bailey. I'm not gonna mess with that one yet. Let me ask this quick question from Agnes. I got two questions from Agnes here. One says, are people being tested for COVID before receiving the vaccine? And then there's a second part of the question that really says, is it a requirement to be tested for COVID before receiving the vaccine?
No. So no, if you think you have COVID, if you have symptoms, you should get tested first, because you want to wait the 10 days, the full 10 days minimum before you get it. Up to 6 months is fine. And you're still thought to be protected. But no, they do not recommend testing before the vaccine.
All right. And now Elder Bailey is my, she might be a lead into a question I wanted. So thank you. Will the health department be getting additional help to get people in faster?
We are, and we are getting help. And so remember, and please be kind, I 3.5 weeks there. So, and my acronyms are bad, but the Greater Flint Healthcare Coalition, is that right?
Greater Flint Health Coalition.
Also dyslexic. It's like I always say, I'm the poster child for learning disabilities. But so anyways, they are very generously funding some additional clerical help, and we have had an outpouring of volunteer offerings from nurses, doctors, paramedics. The Sheriff's Department has been helping tremendously. Other paramedics in the area, they have been volunteering their time. We actually do have a really good pool of that, but what we're really short on is people who can enter the data into the correct system, and then also to view the phone calls to get the appointments out. So we're going to be using that funding to hire some additional help to get people called back quickly. And we are just today trying to get a bid for an additional 50 phone lines so we can make a lot more calls.
I will tell you, I feel like good people should know good people. Dr. EJ, Dr. Jennifer Edwards Johnson is in the chat, and she said her students, she's at MSU, would be interested in helping. And so we hope we can make that connection between Dr. EJ and Dr. Hackard.
So are your students nursing or medical students?
Hey, can we pull Dr. EJ in?
I can shoot Dr. EJ in. Dr. EJ, can you jump in the conversation real quick? We're going to pray she's having a good hair day. I'm going to pull her in. She's the new community dean at the Flint campus of the College of Human Medicine. So all of her students are medical students, 3rd and 4th years doing the clinicals.
Yep. And so let's go back to the question that Elder Bailey asked, because it kind of leads back to the question we had earlier about, I just want to unpack a little bit how we're getting, how many do we get in community at a time? Where do they land? I just heard recently my mother-in-law and my grandmother were talking about signing up at Meyer. I didn't even know Meyer was a site. And so just how are they coming into our community? What should we expect? Where should we go? When should we go to the health department? When should we go to sign up on 10 different lists because we have no idea who's going to call us back? Like, how are we navigating that?
It's a wonderful question that many in health and public health have been asking. We are finally starting to really get some firm answers, so I'm going to give those to you.
Thank you.
Once our new national administration started, thank goodness, they have a firm national plan, and this is the first time we've actually had any plan at all. The states were left to do it by themselves, and the states were finding out. And the minute they found out, they actually tried to let us know in local public health how many vaccines we're going to get. The new national plan is based on population, and there is a social vulnerability index adjustment. We haven't quite seen how that's going to work yet, because this will be the first week we get that. Hopefully it does not reflect in the numbers we got this week. Hopefully it's really reflecting next week, because our numbers did not change this week. But they will be doing that. And so instead of having to have the local people say how many they can accommodate, because we were all by now saying we can accommodate 10,000 a week, which we actually can. But they were still giving us the 2,000 to 3,000 a week, because that's all they had. So they will now find out, they'll kind of know ahead of time, because it's going to be based on population with a social vulnerability index, which is a CDC index that's been around for a long time. This is not a new index, and adjust it. Then the amount of vaccine that comes to the state, some of those are being used at a state level Meyer pharmaceutical program. The state will identify 5, right now they're identifying 5 different Meyer pharmacies around the state to try and reach areas of need. Those can change from week to week, so that's why the state's not announcing them. When they tell a certain Meyer, you're going to get 1,000 vaccines this week, they may not get it the next week, or they may. So it's not something that you can count on, that we are going to keep the one that we are getting right now in our community. It could switch. They may give more another week. So that's something, though, it's between the states, a federal program between the states and Myers. That is not, there's also a different Meyer program where the local counties who can't handle the volume of vaccine they're getting, if they're getting too much, they can give some of their vaccine from the county to the drugstore, and the drugstore will administer it for you. So that's the 2 Meyer pieces. One is the state plan that we don't really have any say about. The other one is something we can, if we needed their help, they're willing to help. Then within the remaining amount of vaccine, some are being taken off to meet certain populations that are mandated by the state. So that kind of brings the state level down. So now we're at the local level. How much are we going to get for Genesee County? The state determines what it is. Half of those are going to, right now, it changes week to week, but right now, it's 50% of those are going to go to the hospital system so they can help vaccinate their own people who've ever been a patient there, who meet the 65 and up goals. And then the other half go to local public health. And that is where we stand today. It may or may not be where we stand next week, but we could do this as often as you want, and we can update you. I'm happy. I think this is something that's really important to know. And I was just saying this yesterday morning, like, Meyer, what do you mean Myers? I didn't know Meyer had it. So we didn't know. And then the state told us. So there's a lot of people asking for more transparency. We are getting more transparency. But that wasn't the case until just recently.
Yeah, it would be really helpful. I mean, I'm not going to even blow your mind on. I just heard about VGs and DNWs and other. I just heard about other groups that we're going to be getting this thing, and all it does is add to the stress level of our aging seniors. Right? My grandmother is trying to figure out where to get the test. She hasn't been called back yet, and she's like, "Is it Meyer? Is it VGs? Is it DNW? Is it Walgreens? Should I be getting with my health practitioner or the person who's providing me services?" They're going on the site, the shows that Dr. Yvonne Lewis and Dr. Debra is doing, and they're trying to figure out where to get information from. And so what you just shared was really helpful. We have Dr. Johnson in today. I want her to talk a little bit about our students, maybe to answer that question directly.
Yeah, thanks so much. we have College of Human Medicine students who are excited and willing and just wanting to be a part of the cause and wanting to get out there and vaccinate people and make sure that people are getting shots in arms. And they're just excited, willing, and ready to do whatever they can to kind of help the process. So we love to collaborate. Go ahead.
Would they have, would you have any opportunities where a faculty mentor could come with them?
We absolutely do. We have our own Laura Caravala, Dr. Caravala, who has been more than willing and is kind of spearheading the effort of getting our students kind of volunteering at some health clinics that have or vaccine clinics that have already kind of happened. So we are looking to partner. Our students are in the community and all about the community. So they're excited. And we have lots of faculty who would totally support this.
That would be wonderful. And one of the areas that are really targeted that we're trying to reach out is homebound people. Mm-hmm. So if that would be, like I would trust them with our fragile vaccine. So this vaccine doesn't have preservatives in it. So it's very fragile and you have to kind of care for it. I would trust them totally. So if they were interested in doing that, we would definitely have a place for them. But we also have a place for them in our clinics.
So
we also are excited. Oh, I'm sorry. Go ahead.
No, please, you go ahead.
I was just going to say, we are also excited. We are located downtown Flint, right in the middle of everything. And we've had conversations about even having joint partnerships where we have joint clinics so that we can, we have that space. We are right by the farmers market. And I know lots of people love and know that area well. And so great opportunity to have people come through, do drive-through shots, whatever the community needs.
Thank you. Do you know Kim Van Slyke Smith?
Yes. Yeah.
So we'll all be working together.
So good people should know good people. I'm glad. So my mom always says, stay ready so you don't have to get ready. So thank you, Dr. EJ, for being ready to be pulled in and have some conversation here with us.
Great.
Definitely could have had better hair days, but
So let's you don't get a break, Dr. Hackard. I will tell you, I saw Yvonne Lewis leaning in a little bit. I think she had a follow-up to a comment you had a minute ago.
I do. Thank you, Isaiah. Dr. Hackard, you were talking about, or so Dr. Pam and I, you were talking about waiting. A person has gotten the virus and they're now wanting to say, I don't want to get this again. So can you explain to us why it's important to wait the period of time you're recommending before getting the vaccine?
Sure. So I will tell you both things. I would tell you what I'd tell my sister. I will tell you what the CDC is saying right now. So both. If you were my sister, which I suppose you are, yes, then I say I would probably wait about a month. I would not want to lose my place in line. If they call me, you want to wait that 10 days, and those 10 days are because you are infectious to others still within those 10 days.
And that's the key. I'm sorry, but I just want to make sure you make that really, really clear that that's an important time frame and why.
Yes. Okay. So you are infectious to others during the whole time frame. Most infectious at the beginning, but still infectious at day 10. And then it drops off dramatically after that. But on top of that too, your body's already got its immune system revved up to fight the virus in your own body. And you do not want to rev it up anymore until it's starting to settle down with the 10 days. So that's why I would personally say I would wait between the 1 month and 3 months, because we do feel very confident that for 3 months, you're not going to get this virus again. It's looking like it's 6 months. So you will see a lot of material. The newer material is saying 6 months. You can wait we recommend waiting 6 months. That's what the CDC is saying. But it's a very rare commodity. It's a rare gift to be able to get the vaccine. So if you were offered the vaccine after a month, I would definitely take it. Personally, I would take it.
Thank you.
All right. So Dr. Debra, earlier Actually, hold on. I got Dr. EJ here as well. So I want to go back to something I saw in the chat a little earlier. Dr. Bobby was saying that they're medical professionals that would like to volunteer beyond students, in this connection that we made between Dr. Hackard and Dr. EJ. If there are medical professionals, there was a link thrown up, and thank you for throwing that up again, SurveyMonkey, where you can volunteer with the Genesee County Health Department. So please do so. I know a good friend of all of ours, Joanne Herman, had said she was doing some work with the health department right now around volunteer sites. And so, I mean, there's some amazing folks that are doing amazing things. And so I'm excited to not only be able to make some of these connections, but also to give this information out. So thank you again, Dr. Bobby, for sharing that. So
Dr. Bobby teaches our students. So shout out to Dr. Bobby.
And Dr. Bobby is one of the new appointees on the COVID vaccine task force. Dr. Bobby,
Dr. Bobby, Dr. Mona Hanatisha, Dondre Young, and Dr. Lawrence Reynolds.
And Dr. Reynolds, yeah.
Flint is definitely represented on that task force.
And this is what that begets. This is what this begets. So you got people all over the country. What she say? Y'all make me want to move to Flint.
You should.
Yeah.
So back, I want to go back to Mrs. Yvonne Lewis. So just
Yes,
if you don't mind for a minute, you engage with community in the most authentic ways. You're there, you're in and of community, you represent community. What types of questions are you getting that you don't have answers to, that you would like to ask Dr. Hackard or Dr. EJ or Dr. Furr-Holden right now that they can answer for other folks?
Yeah, and so part of it was this whole piece about the time of infection, because it's not clear. Because even now, getting to the vaccine, if I get the vaccine, can I no longer wear my mask? And, you know, as long as I get the vaccine, I'm footloose and fancy free. I can go where I want. In addition, if I've already had the vaccine, if I've already had the virus, do I still have to mask up? Am I free to go out and about and do what I need to do? I got that question. Actually, that question came just a few minutes before this webinar, this session tonight, and so it concerns people who we really don't get these clear distinctions sometimes, because we're so excited now. Because I've heard, oh, it's hope out here for us. We got the vaccine. We're ready to go out and be out in the world again. So help us. What's the real deal on that?
Dr. Edwards-Johnson, do you want to speak?
Sure. The vaccine definitely represents hope. I definitely think we should be hopeful and we should be excited. But we should absolutely still be wearing our masks and distancing, right? One of the things we don't know about the vaccine is how much it prevents our ability to spread it to others, right? So we are vaccinated, and when we get vaccinated, we might be protected, but we might be unknowingly taking the virus to other people who may not have been protected. And so there's still that risk, and there are still some things that we don't know, right? And so while we don't know things, it's best to still wear your mask up, wash your hands, and distance from people. And then we can be really excited and hopeful about the opportunities that are coming. But in the interim, we just got to do the work of washing our hands, wearing our mask, and keeping each other safe.
So Dr. Furr-Holden, I'm going to pull you in here from our Dr. Fauci, right? We're talking about public health. And we always assume the vaccine is like a silver bullet. A lot of people feel like the vaccine is a silver bullet. I would like to describe it more like a silver buckshot, maybe 10 layers of a buckshot. And so if you could talk a little bit about the multiple layers impacts. So tell me what the MLIS, multiple layers.
Multiple layers improve success.
Thank you. Say that again, because everybody needs to really kind of know that. Multiple layers improve success. This is the silver buckshot. There's no one silver bullet coming, but there are multiple ways that we can handle this. And there's some shared responsibilities, and there's some personal responsibilities, and then there's some overlap. You could just talk a little bit about that, because I think you make it a lot simpler than the way I just tried to describe it.
Yeah, sure. So you've heard about this. It's the Swiss cheese model. And if you know about Swiss cheese has holes in it. But the way it's made and how the little air bubbles get made in it, those holes don't go all the way through the whole loaf. So if you slice up a Swiss cheese and you start to build layers, Each layer is a bit imperfect. The vaccine is not perfect. As Dr. Johnson said, it's a real good dose of hope, right? It does add an important, albeit imperfect, layer of protection. So the vaccine might prevent you from contracting the virus, or if you contract the virus, it might prevent you from getting really sick, but it might not stop you from spreading it to others. So we got to continue to put those other layers in and still practice them. It's why the personal responsibility, things like hand washing, masking up, practicing physical distancing, etc., are so important. But then there's also other layers in shared responsibility and also governmental responsibility. I had some conversations on the radio this morning, and a woman called in, and she's a phlebotomist, and she said her job is push them and really pressuring them to get the vaccine. And she said a couple of people took it, and they had some side effects. One woman had a really bad headache. Another woman got really, really tired, and the job wouldn't let them take the rest of the day off. So, you know, there's these other layers, right? So we need governmental support. We need good messaging. We need the kind of supports for people so that they can effectively shelter in place. We need supports from employers for people. There are things that we've done in the workplace and in school environments to make them safer. Our kids in Flint and Genesee County are back in school or going back. Flint Community Schools goes back on the 22nd. We know we need good ventilation in the schools. We need the classrooms to not be as dense. So all of these things, if we put them all together, especially at the same time, each layer might not do it by itself because it's imperfect. It's like a piece of Swiss cheese. It has holes. But as you start to build them up and stack them up one by one, you build this nice wall of protection. So the vaccine is one important, albeit imperfect, layer of protection in that model.
Could you put that on a t-shirt for me? I mean, that's the kind of breakdown that makes sense for me, right? Because I walk around thinking, okay, if I just mask up and socially distance, and if it gets too dense in here, then I can leave, and that's my part. And then there's another part of it related to jobs and work that's somebody else's responsibility. But there's some overlap. There's some overlap of my responsibility as a person, an individual in this community, and the responsibility of systems that are meant to protect. And I think it's important for us to understand where those overlaps happen and where we're dependent upon one another for the future of our communities. And so thank you so much for sharing that.
Sure.
So that was Jerome Thurkill said multiple layers, improve success. He was trying to help me when I was fumbling through that thing. I appreciate you. Yeah. So April Nunley says, I'm a 27-year-old Black female, and I'm concerned about taking the vaccine and then having children, especially after the water crisis. Mm-hmm. And so if you could, and I'm not sure who wants to take that one first. I don't know if you want to jump right in, Dr. Furr-Holden, if you want to jump in, Dr. Hackert. But I think this overlap of both questions that people have and a little bit of myth busting kind of needs to happen here, maybe twofold.
So I'm happy to answer any of the medical component, but I would defer to Dr. Furr-Holden for the perspective both on EPI and as a resident of Flint.
Thank you.
All right, so here's what I can say. There's no evidence or data that we have right now that getting the vaccine should have any impact on pregnancy. There's nothing that we have that points to that right now. The valid question that you raised about taking the vaccine, having children, having recovered and come through the Flint water crisis, this is the cumulative effect of all of these various, I would almost describe them as traumas that people have faced. This has been a traumatic experience for people going through this pandemic. You know, supposedly we were like one of the, most highly, pandemic prepared nations. Yet here we are, almost a year later, still very much in the throes of it. And so I can appreciate, and I have a lot of, just my heart goes out because as somebody who moved to Flint in the midst of the water crisis, I get that. I've often asked myself, I hope this doesn't have any impact on my daughters and their fertility and other, kind of measures of health. But there's no evidence that would suggest that the vaccine is going to do anything to impact your ability to have children and have those children be, healthy and all of that. And I think that the most important thing is when you endure things like what we endured in Flint through the water crisis and things like that, that you have access to what you need to be well. And it's not just physical wellness. Those are traumatic experiences. And so being able to unpack those and make sure that you're supported and are well as a part of your recovery is important. But I don't think there's anything about the vaccine or a combination of the vaccine and the water crisis that should impact somebody's ability to have children.
Dr. Deborah, and I remember having this question answered before on a call we had before, and Dr. Bobby did an amazing job of answering it. He has an explanation in the chat, but if we could, and I don't know what our limit is here, if Dr. Bobby is available, I would love to pull him in and have him answer that question, because he's amazing at kind of breaking it down for us. In the interim, I am a Flint educator still waiting for the vaccine, registered with GC4Me and Myers. Would like to have both vaccines done before kids come back to school on the 22nd. Dr. Hackard, could you talk anything about special accommodations we're making for, or provisions we're making for teachers that are looking to get back in the classroom, understanding that there was a push from state government to maybe make some provisions for students coming back by March 1st. And I think Flint Community School students going back on February 22nd puts a bit of a push on our teachers to make sure they're protecting themselves and their families.
Right, absolutely. So we had our 2 clinics this past Saturday that were just specifically for teachers, and we administered, don't count me on exact numbers, but about 1,260 vaccines. We meet with the superintendents of schools every week, and we had been trying to set some parameters, because we knew that 1,200 was going to be about 20% of the teachers right now who would meet the qualifications. So what we heard, though, and we were listening, is that the superintendent said we would rather have it allocated based on student population, and then allocate it within our own districts, trying to follow the parameters. So what we had done was we put the top priority were the 3 special needs school teachers, because those are the children who are most likely to, take it off accidentally or not be able to keep it on. And those were the topmost. So those were separated, and then we distributed the remaining vaccines within the different districts, with the request that it be given only to people who actually do face-to-face contact with the students, because we did not want, perhaps like the administrators who don't have contacts, they are able to socially distance from the students. We didn't want those people to be, necessarily prioritized. And then we suggested 50 and up, because that is the cutoff where you do see a much increased risk of serious illness with it. So, but they had said, could we, we have one person gave an example, and with this example, we said, yes, that makes sense. They said, we have a lot of people here who don't want the vaccine at all yet, but we also have a 45-year-old woman who has cancer and would really like it. And it's like, okay, we don't need to make that decision. So, yes, we will allocate it, because everyone is in agreement that they want to allocate it within their own department. So that's what we have done. We know it's not enough. It's only 20% of the people. But going forward, we are trying to do another large school vaccination event. And remember, when I say like a week, it's really a week more, because our planning starts on the Wednesday of the week before we get it. So when it would be, I think, next Wednesday and the week after. So 2 weeks from now, we're also still hoping to do another very large vaccination event, particularly if we can get more vaccines.
Thank you so much for that answer. As we think about myth busting, Dr. EJ, kind of put you on the spot here. What are you hearing people say about people of color and the vaccine that you would? It's like one of those things. It's like, if I hear it another time, I'm going to go crazy. I need to respond to that.
I think the biggest thing that I'm hearing is what we addressed earlier. This idea that either once I get vaccinated, I'm protected and I don't need to wear my mask and distance. And I think that's an important thing that we touched on earlier. Still have to wear a mask, still have to wash our hands, still have to sort of physically distance. As I think through things I've heard, I guess I would talk a little bit about this idea that our communities have a lot of vaccine hesitancy. And I think that is true, but I also think we need to be thoughtful about how we are talking to our communities, getting education out to our communities, and how we're making sure our communities have access to the vaccine. If we look at the populations who are kind of in the phases of rollout, we have to think about how those are equitably distributed as well, and how we're getting the vaccine to diverse communities. And I think those would be the things that I would highlight, that we need to be thoughtful about ways we can get the vaccine to communities and educating communities. And we still need to sort of do our due diligence, washing our hands, distancing, and wearing our masks.
And then we have a question from Jun King. I'm not sure who Jun King is, but I'm glad he asked this question.
June King. That's June King.
June. I was looking
June is in Philly.
You know what? I'm not messing with June from Philly like that then. Okay, so listen, can we categorize validity of myths related to viability of vaccine with any concerns over supply levels, consistency of proper storage, and incomplete inoculation practices?
Wow.
Yeah, I'm kind of like, wow, I'm not sure if I understand all those words.
And there are plenty. I think there are plenty myths around supply levels, consistency of proper storage, what people have to throw away, what they can't throw away, how are they getting them into the arm within 7 hours of opening the packet. Like, we're hearing all of that stuff, and we don't know if it's the truth. Is it a myth? Is it the reality? But I'm seeing pieces of it on the news, and I'm making sense of part of a sentence here and the back end of a sentence there. I'm not a medical professional, and so it's probably asking a similar question that many of us are asking when we're watching the news. Is it a real supply issue? Is it a logistics issue? Is it a proper storage issue? Like, what's the problem with getting what we know as 975 dropping in one place into the arms of 975 people in the tiers that we've seen rolled out? Like, we rolled out a plan, but then we see tier 1 people, and Deborah says 60% of them got it. That means some other people, 40% of this went to someone else or went bad. What happened? And I think that's the question that he's asking.
Okay, so that I can answer that one. So he
said exactly. So that means I got that one right.
So they opened up phase 1B before we were complete, and they knew they were doing that, but they wanted to give flexibility. This was the party line. They wanted to be able to give flexibility to the communities depending on where they were in their own vaccine process. But they also acknowledged that really no one was done with 1A. So we then, instead of just expecting the 1B we had, which was 75 and up, they also kind of dropped on us these lowering the age to 65. And when you look at phase 1B, that's actually about 40 to 45% of Michigan's population right there, which you're all going, what? And so these are fragile vaccines. We do maintain the chain of custody for cold storage. The 975 minimum doses for the Pfizer vaccine that has to be kept in that very deep freezer, they're actually sent out though in vials of 5. So it's 5 doses per vial. So we can actually go over. So Hurley is storing those for us, and thank you, Hurley. It was a really kind and quick offer. When we found out we weren't going to be able to get any Moderna vaccine for a certain week, they said, we'll store it for you. So we can go over and just get like 1 vial if we wanted to. So it's not like you have to actually use the 975 right then. We did use 980 because once in a while they have more vaccine in the vial than is necessary. They always put in a little extra because they want to be able to, if you load the vaccine, they want to be able to let people have a little bit extra to get the air out. So depending on that, sometimes we had 5 vials that had an extra 6th full dose. So it's a viable dose. So we administered in 2 vaccine clinics within 4 days of receipt, 980 vaccines. So I think that part of it is depending on the state. I won't even say in the Michigan, as far as I'm aware, we haven't lost any because of inconsistent handling. I may be wrong, but I do know what we've had in Genesee County, and we have not had any of that problem. We are being very careful. If we are at the end of the day and we have 1 or 2 doses left over, we do not let them go to waste. We will, ask, does someone have a parent? Does someone have a grandparent? And we will vaccinate to make sure we get every dose in the arm.
All right.
Did that answer the question?
It does. Thank you, Dr. Hackard. Now, we put in Dr. Bobby, Dr. Bobby McCullough, because he answered so eloquently the last time we were on a question around a person talking about having children. But this is a 27-year-old Black woman, says she's concerned about taking the vaccine and then having children, especially after the water crisis. And so you were offering an answer in the chat, and we thought it would be great to just pull you in to respond to that real time.
Sure. Yeah. Thanks, everybody. So this desk right here behind me belongs to an OBGYN. And so my wife Nita is an OBGYN. And so this is obviously right up her alley. So I see a lot of what she's been reading in the journals that come to our house. So I think the authority on this, the most scientifically valid opinion, comes from the American College of Obstetrics and Gynecology. And so even though there haven't been specific tests on that population of pregnant or lactating women, ACOG, the American College of Obstetrics and Gynecology, says that if somebody meets the criteria, that they shouldn't hold back from getting that vaccine based on everything else that ACOG has looked at about the safety of this vaccine. And so I think it was very, to Deb's answer to that question was very eloquent also. And that here are the people that know all there is to know about pregnancy and lactation and maternity and that sort of thing. And they're saying that if you meet the criteria and if you would otherwise qualify or need the vaccine, like if you're a healthcare worker, for example, that's pregnant, that you should avail yourself of this vaccination based on what they know and what they've read.
Thank you so much, Dr. Bobby.
Dr. Bobby's hair looks better than mine. Why is this a thing? Like, Dr. Bobby was ready. His hair looks great.
Dr. Bobby's hair always looks great. That's the thing.
You should see the pile of product I got to make it stay like that.
So thank you, Dr. Bobby, and also thank Dr. Kulkarni for that, for whatever you borrowed off of her desk. We appreciate it.
Yeah.
And because we're at the last 3 minutes here, and I always commit to being really close to 1 hour. That way, when we call our friends back, they answer the phone. I want to give you all a moment to kind of do a bit of a closing thought. Things that you want people to know as they go and wrestle between whether or not they're more afraid of COVID, more afraid of the vaccine, as they're looking through information about the vaccine and making the best decision for them and their families. What should they be considering? What should they be looking for? And where should they be going to for information? That said, I'm going to stop. That way, when we go over an hour, it's your fault and not mine. So we'll start with the last person to jump on the call, Dr. Bobby. We'll go to Dr. EJ. Then we'll go to Miss Yvonne Lewis. Then we'll go to Dr. Hackert. Then we'll go to Dr. Debra.
Sure. So I'll just jump in and say, right now the choice in people's mind is whether or not to gain immunity from getting the infection or to gain immunity from getting the vaccine. And just last night, I was on a call, a continuing education call about the long-term consequences of COVID. And there were slides that were being shown that were quite scary, actually. The inflammation in the heart, the inflammation in the brain, things that we don't have answers for, but we're noticing even in those people that are 40% asymptomatic, they're still showing these changes. And so given the choice of having a little fever, being sick for 24, 48 hours versus long-term 6 months, 8 months out, potential chronic fatigue issues, I'd take that vaccine all day long.
Thank you, Dr. Bobby. Dr. EJ.
I agree with Dr. Bobby. And I just want to say communities of color have been struck by this COVID disaster, really, at terrible rates. And so I want to be thoughtful about that and make sure that we're getting the education we need. So if you have questions, if you are unsure, I want to encourage you to reach out to your sources and make sure you get the answer that makes you feel comfortable about the decisions that you have to make.
Yeah. Thank you, Dr. Johnson, because you kind of piggybacked a little bit on or stated what I was thinking in terms of education. That's why we do a lot of these conversations. We want our community to be able to make informed decisions. And growing up and hearing all about Tuskegee, there are some things about it that people bring forward into these conversations every time. So that's another little conversation I think we need to have later. But I'd like to encourage us to think about, and this has been my personal challenge. We hear a lot about vaccine hesitancy, and it sounds very negative. But I've become to look at this journey as vaccine openness, because I don't know. But if I'm not open to asking the questions, I may never find out what I need to know to make the best decision for myself and my family. So I just want to encourage us. There's a lot we don't know, partly sunny, partly cloudy. It could change in the next 5 minutes. But the best thing for us to do is to ask those questions, though may be tough, get the answers, so then we can make the decision that's best for us and our family. So I look forward to more conversations.
So I'm sorry I'm going to be a little long-winded here, but I have 3 points to make. One is Tuskegee. I did a lot of, every year I did a syphilis talk, updating the syphilis talks for our nurses. And I also taught the infectious disease fellows for Beaumont Hospital every year. They rotated with me for 2 months, each of them. And I always made sure I did that. And even though I would vary the other pieces of it, I always insisted on doing 3 slides about Tuskegee because I think it explains so much of what, the outrage is in terms of audacious behavior. I mean, it was absolutely awful. Second piece is at my work at Henry Ford in occupational medicine, we take care of all the Jackson prison guards. And so they were one of the earliest, hardest hit groups. They had an 80% positivity rate by the end of March, beginning of April. And I was taking care of them. I actually went out and did some house calls because it was cold and blowing, and I just had them breathe the other way. I had my mask on. I wanted to hear their lungs, and I didn't want to send them to the hospital because it was such chaos at that point in the whole medical field, not just that hospital. It wasn't there. But so I saw a lot of very healthy men and women who had this very early. And one of my the last day I was there on December 30th, I saw someone who had gotten it. She was a nurse in one of the Jackson prisons, 43 years old. And I was still seeing her the day I left, December 30th. And I also, because her lungs were so bad, she couldn't breathe still. She was still off work. She had been sent to the independent medical doctor to make sure that she couldn't go back to work, and they agreed, which is a very rare event. So I also had a 21-year-old who said, I was a marathon runner. I would do 5 miles every day, and I would run marathons once or twice a year. And he said, I can't even do 9 holes of golf now from a golf cart. And that was 4 or 5 months in. So it hits people more than we know. It's not just about mortality rate. It's not just about the death that's involved. It's about the health of their life, the wellness of their life that follows. So that's my second piece. And the third piece is just personal advice. You probably do want to know more information, but put your name on the list. Put your name in the SurveyMonkey, because we have 30,000 people on that list. If you qualified to be putting your name on there, put your name on, and you'll still have probably 4 to 6, 7, 8 weeks before you have to make the decision on whether or not to accept the spot.
Thank you so much. Dr. Furr-Holden, take us home.
Yeah, I just want to thank people for trusting us and coming here and asking the questions and continuing to grapple. I want to make it real clear for people. I'm fighting for multiple layers for people. There's a movement afoot to make sure that there's equity in the distribution and the administration of the vaccine. I honor people where they are. I honor people for being in the process of getting the information and making a well-informed choice. And we're going to keep doing the work on all fronts to make sure that people have all of those layers in place, including good, credible messaging, including the kind of governmental support, including equity and access to all of the things that you need to be healthy. I do fundamentally believe that while the vaccine is not a perfect layer of protection, it is an important one. And I just don't want misinformation to nip away at it so much that it leaves people not willing to take something that is ultimately, I think, going to be in their best interest. So I'm going to say, like my brother Isaiah says, let's keep talking.
Man, I appreciate you all taking a moment out of your offices or your living rooms or your basements or your kitchens and talking to folks, giving time and talent. We always talk about philanthropy as giving treasure, but giving time and talent to make sure people have everything they need to make the best decision, the most responsible decision for them and their families. And so I appreciate you all. I am not going to talk very long because I'm going to call you again to do this some more, and I want you to answer the phone. So thank you again for joining us. For all of the folks that are listening, share. There was some information shared tonight that will be helpful to your friends and families. Make sure you get this to them, and you can tell them that the few minutes that we went over 1 hour was all Ernestine Yvonne Lewis's fault. We're off of here. Thank you.
Bye, Isaiah.
Can't trust your own family.
Bye.
Your
Dr.
own
Bobby,
family.
Dr. Bobby, thank you. I have a request. I have a very serious family concern that I really